Hi, dear listeners, and welcome back to Blush and Bloom, the podcast where we talk about women's health, self care, and everything in between. I'm your host, Gigi, founder of Asele, your space for cycle aware and preventive care. I'm really glad you're here with me on this journey to unpack women's health and highlight the incredible things being built in this space. So let's get into today's episode. All right. Thank you so much, Dr. Patience. It's so great to have you here. So please, could you introduce yourself for our audience?
Oh, thank you very much. So I'm Patience. I'm a doctor. I'm a trained doctor and co-founder of Mama Me Foundation, as well as founder of MyLurah. I also hold a master's in public health, and presently now I'm just juggling between being a founder, a co-founder, and just day-to-day activities and just exploring the public health space.
Amazing. That's really cool. So, speaking of juggling, being a founder and co-founder, could you tell us a bit more about your company, MyLurah, and maybe also a bit about your foundation, Mom and Me?
Okay, so MyLurah is an extension of Mom and Me Foundation.
Okay.
We started Mom and Me Foundation. It was launched earlier this year, and the Mom and Me Foundation is a maternal and child health NGO. So what we do is we focus on helping to reduce, the number of maternal mortality, specifically in Nigeria at the moment. The reason why we are focused in Nigeria is because of the numbers, the data, and the statistics of maternal mortality. At the moment, Nigeria contributes about 20% of maternal mortality, like worldwide, which shows that there is a need for public health interventions when it comes to maternal health and child health. So the foundation was started because of the need to cover to an intervention that will help this gap. There's as much that the government does in Nigeria and other NGOs, but it's still not enough, About 90% of maternal mortality in Nigeria can be found in the northern states. And if you talk about 90 or 98%, is actually a very large number. So most of our work now is in northern Nigeria. And we are working with Mom and Me Foundation through our SDG, which is education. So helping to educate women, on lifestyle choices, encouraging women to go for antenatal visits. And there's a lot of things that is, connected to maternal mortality in Nigeria. And it's just really broad. Because if you look at things like access to healthcare, you start looking at things like lack of education, you start looking at women empowerment, you start looking at all of those things. It's just a really big branch of issues and things that's connected to maternal mortality. So we use those intervention through good health and well-being, which is SDG 3, and then quality education, which is SDG 4. So through our work for the last 7 months, we've noticed these gaps, and that was where we started thinking of how do we, not just through the community approach that we are doing with Mom and Me Foundation, what else can we build that will bridge those gaps? And that was where we started thinking of digital solutions, digital tools, and looking at how femtech is providing solutions, especially in Europe and other places. But then if you look at the growth of femtech in Africa at the moment, is really huge. So that was where we started thinking of how do we provide a digital solution that is not just for another continent, but just something that is for us, that understands us, that speaks the language that we understand. If there's one thing that we're really keen on when it comes to the digital tool we are providing, is how does it actually listen to listen to African and Black women. So because of that, as we started building MyLurah, and MyLurah is a femtech platform that we're building that will help women, but specifically for Black and African women, to be able to track their periods and help them through the pregnancy journey, and as well as postpartum. Because one thing that we've noticed through our work is that we unintentionally, I guess, take away postpartum from the care of African women. And even if you look at maternal mortality, because some women would give birth successfully, but then after like 6 weeks, 7 weeks, complications start. But because there's no follow-up that would actually check that something is wrong, we tend to have really high-risk complications that would have been prevented, or even women losing their lives. So that's why I started thinking of how do we now also create something that will take African women through the journey of, postpartum. So something like that would give you recommendations, danger signs to look out for, and all of those things. So that's how we started MyLurah. So
That's really incredible. And I love that you're building this. I agree with what you're saying 100%. Like, there isn't a lot of conversations around how women should be supported after giving birth because it seems like after the woman just gives birth, it's like you finally achieved the thing.
yeah.
So I really like that. I really like your building. I don't know if you've spoken because I had a podcast episode with Dr. Aisha. She's also working in the north as well. So
Wow.
to the gynecologist, maybe I can like do an intro or something because I think
Yeah.
you two are doing like really incredible work. This is great. So how has your experience so far across clinical work, public health, and project management shaped how you're building MyLurah?
I think what I always say is that I believe that all the journeys connected. At the moment, I'm not in clinical medicine, and just like I said, after medical school and all of that, I went straight into public health. And the reason why I did that was because I was trying to approach care from a broader view. It's not just about patient, but how do we fix the system that's already broken, especially for African women. And I think that's what public health kind of gives you, to see medicine gives you the view of, patient care and all of that, the treatment and all of those things. But public health gives you the view of prevention. It gives you the view of why what is happening is happening. So why is it that there's a large number of women that are dying because of this? Why is it that this is happening and what can we do to prevent it? And it's using real data, and all of that. So during my clinical experience, obviously, like understanding how, doing some of this course like gynecology, understanding how the woman's body work, function, and all of that, complications, diseases, treatment, and then coming into public health and just seeing that is actually a little bit different because being in public health, just like I said, you're not looking at the treatment, you're not looking at medication or drugs. What we are looking at is how to fix the system that's broken. So I would say that my clinical career gave me knowledge when it comes to treating what is wrong with individuals. Yeah. But public health gave me project management skills, critical thinking skills, because if you want to provide a solution or innovate something for women or then healthcare system, you have to critically analyze. And I think that is what I'm not going to say that. I'm not saying that medicine doesn't give you the mindset to be critical.
Mhm.
However, you are in public health, you criticize what you are being taught, like you have, you just don't learn something like in medicine. You could learn when somebody is sick, maybe when somebody's having fever, this is what you should give the person. But in public health, there's no really one correct answer. Is based on the people that you're working with. So let's say if you want to create an intervention, let's say you go to a particular state in Nigeria and you've noticed that there are a lot of women there that maybe die during childbirth. Now, what you have to start looking at is why is it this woman died due to childbirth? So you could find out there that maybe because they don't go for antenatal visit. So the interventions you create there is for those specific people. You understand? And you could leave, let's say, northern Nigeria, maybe go somewhere, maybe you can
Mhm.
go to Ghana and a community in Ghana, and people go for antenatal visit. But what you understand there is that actually is because of cultural differences of the fact that people don't trust the system when it comes to healthcare. So you now create intervention based on the people. So public health
Mhm.
is not like a one-way thing. You
Yeah.
criticize, you analyze, you create interventions for the people. But in medicine, you don't create treatment for one person based on how the person's body is. Do you understand what I mean?
Yeah.
And that's where we even find limitations when it comes to care, even for Black women. Because if the system doesn't really do so much research on Black women or why they act, why things like, let's say, fibroids or PCOS is high in African women, and you're
Mhm.
giving them treatment that wasn't made for them, then
Yeah.
you understand what I'm saying? Then is
Yes.
care shouldn't be a one-way thing. I feel like it should be you know,
It's
care should be made
responsible.
for the people, yeah, for the people that actually need it. And we shouldn't use a one lens way to look at care for women or men or all of that. So I think that's what it gave me. And then my early experience in project management taught me how to manage project. So is how do we actually bring something to life? Because if you look at building Mom and Me or building MyLurah, it takes a lot of project management skills
Mhm.
because you need to really plan, you need to know. And then if as well, if you're leading people, and that's what public health gives you. There's a course we do in public health, which is like, I'm happy to get like leadership skills and all of that. So that gave me the skills that are needed for mom and me.
All right, that's really exciting, and I'm happy to hear that you're one of the people taking the charge to like build something for specifically for us, because I love that the way femtech is growing, and I really enjoyed the conversations I've had with a lot of women so far. And then bringing it back to Nigeria, it's like super exciting to see that like there are people actually like building out products just for us that meets the particular needs that we have, because there are cultural nuances, and it's really great to like have apps that meet people where they are.
Yeah, true. I agree.
So speaking of building these inclusive apps, so like MyLurah is actually taking the women who are in this space.
Yeah.
So what does it mean? Like, how has it been like for you building an app that's different from, say, something that's built in general for women in general, and building something that's specific to African women, like or Nigerian women? Like, what are the differences that you've observed so far that like this is something that's unique to having an app that's built for Nigerian women that's different from everywhere else?
I think what I've noticed or what I've learned building something for African women or Black women is the fact that you need to look at care from the lens of an African woman. And I think it just hit me that what does care actually mean to us? It's like something that I underestimated, like, okay, yeah, care for African women, building something for African women. But when I started and then the questions started coming in, like, how are we building this to actually fit into what an African woman needs? I didn't have, I think there are points where I've paused to actually think about it. And I think it's bad because it shows that the system, we ourselves don't know the care that actually we deserve. I've seen a lot of apps. I've used a lot of apps, even personally for my own personal use, like period tracking apps and all of that. When we started building MyLurah, is how does an app that would help you to track period be different from an African woman? How do we create something that when you open, you see yourself in it? I'm talking about from the colors of the app, from the fonts, from the language. How do we make you feel seen on an app? And it was really hard to do that because I don't think there's anything like that. I don't think I've seen something like that really puts the centers African woman in it, or maybe there is, but I've not seen. And every other woman that I've worked together, we just asking them that, like, what do you think an app needs to have for you to feel seen? And it was a struggle for some people, but I was really surprised some of the answers that, some of these women gave. And it's not really the big things, it's just the little things that when you think about it, actually makes sense. Because if you start looking at care for African, one of the things is that we are often dismissed. One of the things is that a lot of people have lost trust in the system of care. And some of these apps, when you start using them, the languages, the options, the recommendations, even little things as during your period, the kind of food that it recommends for you. These are some of the foods that we don't even know about. We don't eat it around where we are from. Do you understand?
Yeah.
So if somebody's using an app and you're telling the person that, around this time, this is what you should eat, the person would not see herself in that app because
Exactly.
need something that would speak about the things that is around me. So imagine you open an app and it's thinking about maybe this is the best time for you to make yourself a good plate of jollof rice, for example. You would see yourself in that case. You would trust that app more. You would know that this was actually created with me in mind. And I think the difference is knowing that something was created and the person or the group of people who did it are people that look like me. And this is not to say that somebody that doesn't look like you cannot create something for you. But what I'm trying to say is that you understand the struggle of a person if you're living, you have lived what the person is living. So if an African woman, you know that this person that's created or the group of people that created this are people that are like me, they've passed through whatever it is I've passed through, or healthcare, whatever it is that they're going through, or they is based on real experiences of African women. I think that is what really makes a difference. And I think secondly, it's also the fact that one of the things that I've noticed, building this is that you do not have something you're working with. It's like you are building. It's like the first generation of femtech for African women. So you can imagine how hard that is because we do not have a footprint. There's nothing we're actually looking at to say, okay, yeah, let's do this better because that
Mhm.
was something that existed that looked like. There's nothing like that. So everything you're doing is like, okay, this is gonna
Very
work based on your own research. You know, the
Mhm.
effort you put into talking to people, the effort you put into critical thinking, analysis. Let's even forget let's say building the app itself is when we're talking about the African market of femtech, you're looking at there's a lot of things that let's say building in Europe or something is different. You
Yeah,
know, let's say scaling a product, thinking about all of that in a space like Africa is a bit, you know. So there's just so many things that
I
have to think
agree.
about.
Because I'm also building something similar. And when you were saying these were the exact same problems that made me want to build Asele,
Mm.
because like when I was using the period tracker I was using, I was like, I want something that recommends like diets and exercise
Mm.
based on where I am in my cycle. And then it should recommend like food that I actually have at home, not food I should look
Yeah.
in the supermarket that's very niche. Like, quinoa is an acquired taste. We don't eat quinoa in Nigeria, please.
Sure.
I mean,
Very right.
it's recently in the supermarkets now, but then when I was seeing all this like diet plans and everything, I was like, this is something I wish was well adapted to me. And then which
Yep.
is what I started building, which is why I understand where you're coming from, where you're saying like we are the first generation to like we are seeing these problems and we are building everything we can from scratch. It's like also in this age of AI where we have like there are so many languages being adapted and then we are trying our best as well. I think the AI space
Mm.
researchers, especially within the continent, are trying their best to like put our language among the languages somehow so that we can, people like me and you can have like, okay, this is an AI tool that we can adapt and
Yeah.
use for our work. Say we want to like impute an AI chatbot that speaks Yoruba, for example.
Mm.
It's very
Sure.
nuanced, very new. It's really fun stuff. And I'm happy about the advances that we're making so far in tech. It's really, really.
Yeah.
And then the part where you talked about like being able to build for the African market, like this is a very difficult thing that I don't think it's
Mm.
talked about enough, especially for
True.
healthcare. Because I
Yeah.
remember when I even started like building out the building out Asele, for example, I was thinking about the price point because when you're building something like this for healthcare, you don't want to sell people's data. So if you can't
Yeah.
sell data, you need to put a price tag on it.
Yeah.
And it also helped me reflect back on when I was in university and then I was trying period apps and I was looking for one that was just easy for me to use. And then I had to choose between Clue and Flow. And not to like name drop them or anything, but like Clue is very, very heavy on data privacy. You have to buy, you have to pay. And Flow is free of charge, but we are seeing that they're getting sued now
Yeah.
for
Yeah.
data issues. So it's like, okay, now we're building this thing and we do not want to sell the data, but
Yeah.
the average woman in Nigeria probably cannot afford to spend money
Mm-hmm. Mm-hmm.
this
True.
product. So it's like, what do we do now?
True. I totally agree with you. And I think that's some of the things you have to think of, you know,
Mhm.
and I think that's the reason why sometimes even companies, startups do not really scale in Africa because there's so many things that you have to start considering. Somebody is willing to pay for, let's say, maybe pay 5 euros for period tracking, but how many people are willing to pay that amount of money? Let's say in Nigeria or somewhere in Africa. Some people don't know, you
Mhm.
know, would not use that money because if you look at it, somebody needs that money to eat, to
Yeah.
do something that you know, that I think that's more important. So yeah, I totally agree with you that those are some of the challenges, and we just have to. I've seen as the importance of also community of people
Mhm.
building things, because if we come together and we understand some of the struggles, then we can start building like a system or structure that would help us.
I agree 100%. I was even thinking back on how like Reliance HMO came up and then they made like health insurance so easy and so accessible. But it seems from my observation that didn't scale because it was so cheap and so easy to get a doctor's appointment. And now it's like, I think they shut down that aspect and pivoted to something else because my guess is people are abusing it or something. I don't know. I mean, like health insurance was like have a whole doctor's visit in a private hospital.
Wow.
It was very interesting. Yeah, yeah, we're really like the first generation to like actively like build
Mm,
out solutions for this. So yeah,
yeah.
this is fun. This is going to be a fun ride.
I know.
Okay, so let's talk a bit more about your Mom and Me Foundation. So, like, how does language and literacy and cultural nuance affect how African women engage with you through your nonprofit? Or maybe you can take this from the perspective of your app.
Can you say that again? Sorry.
Okay, so how does language and
Yeah.
literacy and the cultural nuance of working with, say, women in the North, how does that affect how you approach building your app or growing your nonprofit?
I've come to understand that language is really important when it comes to building digital tools or digital solutions for women. And especially if you're thinking about because one thing we have to look at is the places that usually have high mortality rates, high child or under five deaths in children. What you would see is that there's either a lack of education, the literacy level is really low, and usually these are some of the most important causes of maternal mortality. And working with people who, let's say, are not educated or they cannot speak English, I don't think just because they do not, we should take them out of whatever it is we're building or the app we are building, because most of these women have access to phones. Based on the research or data that I've seen, is about 65 or 75% of women in Nigeria have access to phones.
Yeah.
That's quite large number of, women, because that's some of the research I did on, market analysis and all of that. And some of these women do not understand English. Some of them have access to phones, but they use maybe their language type and all of that. So are we actually building for African women if we do not include language in it? No, it doesn't work like that.
Yes.
So I believe that building for Africa, we have to understand that language is really important. But let's come down to what we are even building when we talk about care that speaks your language. Because when we say care that speaks your language, there's a lot of things that it covers. Let's say things like literal, like your language, yeah, but language in the sense of culture, language in the sense of what is important to you. So most of the women that we work with, they hardly speak English. Most of them speak Hausa or other languages that they have. And that's why it's important for us building this app to create something for this woman that we know that can support them. Because for a long time, we've not created something with them in mind. You can have the privilege of using apps, having access to apps, downloading apps that's only English based because you understand English and you use that. But how about those women? And those are the people that really need the solutions that we are building. Another thing is, when I say I believe that language is really important, and a language that speaks, care that speaks your language, is that we need to understand what is important to people. And when you go to different communities, that things that are important to them. And if care doesn't understand that importance of that cultural importance that people have, I don't think you can really truly create care that they would trust, and a care that will provide the solutions that you think you're creating it for. So yes, language is really important. I think that is one of the things that we've adopted for Mom and Me. For MyLurah, for the app, that we need to build something that people can access irrespective of their language. And we need to build something that cares for you in a way that you understand in, your culture, in a way that would build trust for you. And if sometimes you can think about here that speaks your language as, okay, let's talk about maybe Nigeria, talk about Africa, a community that someone that doesn't speak language, speak English. But when Kia want to speak your language, sometimes it's not even about the literal language like English and all of that. It's about what does an African woman or a Black woman, what are some of the things that mean so much to her based on, the roots and how far she's come. And one of those things you see is that it's community. And community is one thing that we as African women, irrespective of whether you're diaspora or something, you find that you believe in community. Community is like the core of our existence. Believe me. Over time, what has happened is that they've taken away community from us due to Western civilization and all of that. I'm not saying that is a bad thing. But all I'm trying to say is that there needs to be a balance.
Yes.
Because if you take away community from, let's say, a woman who gives birth, for example, and this woman is being left alone to cater for her child, but culturally and from the place she is from, for years, what has raised the child in Africa is the community, the love we give to, this mother. And some of the weight of postpartum is not really on the mother, but on the community of women that are present for you. But recently, we do not have that. So if you start looking at things like why is there lot of numbers when it comes to postpartum in Africa or Nigeria, and you're seeing that it's actually a struggle. Now we have to go back to the drawing board. What is wrong? What have we taken out of what we've known for years? And you can say, the funny thing is that we can even say when, let's say, somebody can be born in the early 2000s or maybe mid 2000s or whatever, and the person just has just given birth. And you will see that the person has not maybe really experienced the community we are talking about. But we need to understand that a person, there's a lot of things that forms you as a person. And some of those things are ancestral that you don't really understand. Because there's some things you don't even know why you really ask the way you do. Do you understand? Because it comes from a place of cultural and a place of ancestry, that this is what we've known. Because each DNA I don't want to go into that, whatever is DNA you carry and all of that, it's from a place that's a connection to the ancestors or the ancestry. And this is something that you've known even before they're born. So we need to start bringing back the things that we think is going to work. And I think that's one of the things that we, Mom and me, and building the app, we are trying to, bring back. And then for our work with Mom and Me Foundation, obviously language is important. And that's why even the volunteers we have, we make sure that they speak the language of the people wherever it is that we want to go, the work we want to do. We try as much as possible to understand the culture of the community that we want to go to believe that we cannot build trust if we do not respect the culture of the people. We cannot come and tell you, traditional childbirth, birth attendants are really not good. Do not go to them. But how about you go to them and say, you know what? How about we train you? We understand that you trust your traditional childbirth attendant. And what we now do is, okay, let's train the traditional childbirth attendant because they trust you. And if you can give you the right medical skills that you need, then we are actually, killing one bird with two stones, I'll be two birds with one stone. And we've used the people that they trust to actually deliver the care that they understand. So I think that's why it's really important.
That was very well put. Thank you so much for sharing that. And speaking about trust, when it comes to building out this project, you already touched on how this can work in practice with collaborating with the people that they do trust within the community instead of bringing in something completely fresh from scratch and then trying to force it on the people. So that's one example, but how can somebody who is building, let's say there's a girl who wants to be a founder and wants to join us in this journey of femtech, how advise her to be okay, this is how you can approach building out trust for your product?
I think I've said some of the things, when it comes to building trust with people. But another thing I would add is that if you are creating something for a group of people, you have to make sure that you understand the struggle.
Yes.
And how do you understand the struggle of people you are building for? Is that you need to, aside from research, you need to speak to people. For you to see, people you trust somebody. No, let's say you can meet a stranger, right? And you don't know the stranger, and maybe the stranger is saying hi, and you're like, oh, okay, hi. And let's say this person is just coming, and the first thing the person is telling you about, actually, this is who I am, and I've built an AI product that is going to help you do this, do that. Now, you are building something for people. You do not make it look like you know it. You know what I mean? You have the whole solution. Yeah. You need to build with the people. You need to listen to them. So you need to make people feel seen. Everybody wants to feel important. Everybody wants to feel seen. If I come to you and I say, actually, I'm building this thing and I need your input, what do you actually think is the struggle of African women? Because I'm trying to do something for you. Now, the person will open up and speak to you about what their struggle is. And based on the way that you speak to them about that struggle, and it's not just about sympathizing, but about, really agreeing with the fact that, yes, and I want to build something that will make you feel seen. It's not about me. It's not about building a product, but how do we build a product for you? I think that is one way to build trust with people. Because if the language, because even from the language you use in advertising your product, if the language is more about there is something we've done, we've built this thing, and this, come use this thing, for example, to track period and all of that, you're not making it about the person. You need to make whatever it is you're building about the people you're building for. And most especially when it comes to femtech, and most especially when it comes to building something for African and Black women. Because if you're building something for African and Black women, these are the people that have history of being dismissed. Their pain is being overlooked. The system does not really care. And the system has not, they're under-researched. So a lot of care that's being given to them is something that's being borrowed from somewhere else. So you need to understand there's a systematic lack of trust that these women already have. Like, oh, okay, it's just another app. Yeah, so what? This is what they usually do. So you need to come with that fire of building with the person. So you need to do excess work or more work in the language when it comes to putting out your product. What kind of language are you using? So I think that's just one thing to add to get.
That was very insightful. Thank you so much for sharing that. You also helped me like put some other things into perspective. So, what do you think most people get wrong when it comes to maternal health challenges in African communities from your experience?
I really think that one of the things that people really need to understand, or I've noticed that, especially through Mom and Me Foundation, is that people do not understand that there's a lot of lack of trust in the system, that you don't look at maternal health in one view. And that's what I was saying in the beginning, especially when I'm talking about, okay, maybe from, let's say, Minister of Health can come and Ministry, you know what? We have a 5-year agenda. What we want to do is that we're trying to build hospitals in local governments, in villages, and wherever it is for women to go. That is one way to look at the cost of maternal mortality, because you can build those hospitals and nobody will turn up, nobody will go. Because especially in Africa, it's not just the access to the care, it's the trust, it's the culture. We have so many things that has happened, or places I don't even believe, just like I said, in going to hospitals. And then we have a lot of women who depend on their husbands, who don't believe that going to hospital should be what a woman should do. Some men don't believe that a woman should go for antenatal visit. Some men are not even ready, to pay for some of these bills. Some men do not believe that women should be treated by a man. So they will definitely stop them from going to the hospital. So you need to look at how broad the issue is. And it just feels like everything is connected to something. And until we deal with the grassroots issues, then we will continue to be part of the statistics when it comes to maternal mortality. Because when you're just thinking of it, yeah, it's just women empowerment, but women empowerment connects to different things. Because when you empower a woman, and a woman, you give her the right education to make a better choice, she will start knowing the importance of going to the hospital, and she'll start making money that she can pay for a hospital bill without depending on her husband. So that's indirectly showed effect in maternal mortality. So I think it's just one of the things is the lens that people look at maternal mortality. And I think that's one of the things that really means so much to me, just looking at these things from different views. Another thing I think I'll say is people underestimating the impact of poverty when it comes to women's health. When it comes to women's health, you'd see that if you have access, if you're rich, it's just like what you do in public health. Because one of the things you do in public health is how to look at the inequalities of health. What are some of the things that makes people not have good health? And you start looking at things like lifestyle choices. You start looking at factors that you cannot change, like the area you're born. You don't choose the area you're born. So if you're born in a poor area, you tend to have poor health outcomes. Why? Because most of the people there are uneducated. Most of the people there make bad choices because of food, cheaper foods, have more fat, and that's what they can afford. And they make those areas find that maybe there's higher. Let's look at things like smoking and all of just bad health choices. And when you start looking at things like lifestyle factors, just like I've said, what you eat, then you go down to look at how poverty directly affects even unemployment. So you go to an area where a lot of people are employed and places where people are not employed. A place where people are employed tend to have better health outcomes because they know they have the money, they have the resources, they have the education to make these choices. But people that are unemployed because they do not have money settle for what they do not, they settle for the basic. They don't really go for the best health care. Some of them cannot afford it. So you have to come down now to start looking at inequalities of health. And I think unless you are in the space or let's say public health and you understand some of these factors, sometimes you underestimate how poverty directly affects maternal mortality. And I'm not even going to go for when you look at Nigeria, when you go to the north that contribute to about 98 or 97%, if I'm not mistaken, of maternal mortality, go to the areas and the local government. Most of them are unemployed, uneducated, are poor, are born into poor families, not like it's their choice, but because they're born into poor families, it's already 1-0 for them because they cannot make better health choices. So one of the things I've seen is that people really do underestimate that. And that is also ignoring postpartum. You find that there are lots of people, I think through my work, people have really underestimated postpartum. Some people don't believe it's existent in African homes or families. Some people believe that African women were really important. What really opened my eyes was as a research I saw, and in this research, they're talking about, do you think that African women, for example, have higher threshold when it comes to pain? 98% of the people said yes.
That's a big problem.
That's to tell you that there's already a systematic problem, because if 98% of people believe that African women are stronger, means we'll keep on being dismissed. When you go and talk about your pain, nobody will believe you. Because they're like, oh yeah, African woman, actually your threshold, don't worry, just go back home. You're talking about your mental health struggle. They believe that you're stronger. Your grandparents gave birth to 9 children, 15 children, and they were doing okay. So what do you mean? Are you trying to seek attention? So I think those are some of the, there's a lot more, but just the last one I'll just say is just data. The fact that in Africa, and I think that's something that when you follow my LinkedIn, I always talk about is the importance of us having our own database. Because if you do not have a data that you understand the people you are caring for, will be depending on other people's data, and that will not reflect the kind of care that we need. So we really ignore the place of data. I know that there's a lot of work being done when it comes to data. I've read somewhere that I really don't know who, but they are trying to build a system where for Africans to kind of preserve their own data and know all of that. So I think data really plays so much, because if we bring the data, just even when it comes to access to care, and we can get the right number of the people that do not have access to healthcare, it will help us to make informed decisions, even in the innovations that we do, because you might not know and build something that people do not need, and be ignoring something that people really need in Africa because you don't have the data to see who, why, what, and all of those things.
Hey, thank you so much for sharing that. And then when you shared that, it reminded me of, I can't remember what I was looking at exactly, but when you mentioned Black women there's this stereotype that Black women having the high threshold for pain, and then people dismissing the pain, how difficult pregnancy is. So that's going to lead to a question, but like, what is your perspective? What do you have to say to people who tend to come off and say like, oh, pregnancy is such a natural thing. You're exaggerating. Your ancestors gave birth in the bush and they turned out just fine. What do you have to say to people who reason like this? Because it's mind-blowing that in 2025, pregnancy it's so natural. Like, there's so many things that happen to a woman's body when she's pregnant and even postpartum. And then people just dismiss it like, oh yeah, your ancestors, they did blah, 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 and they turned out just fine. Like, what do you have to say to those people?
I really don't want to say it as I'm thinking of it now, because it's just sad. I think that's just the answer. It's sad that in 2025, just like you said, people think like that. And it's also sad that you would think about the fact that in 2025, is so much people believe and still compare us to the times of, let's say, forefathers, or where people that have given birth to 15 kids or 20 kids and there was nothing wrong. Now, let me say this. Cannot, and let's not even talk about just African women that have given birth to 15 women or 16. If you look at even European women and you look at in those days, they tend to have more children. You'll see families that have had 15 children, 10, and all of that. But over time, when you look at care and when you look at what's been happening. There's been a change, a systematic change, and not just systematic change, but even in the way we all function. Because if you look at, there's a lot of changes in lifestyle. In those days, it's just like saying in those days, before people see their periods, even in Nigeria, some of them will be 18, some people will be 19, some even 16 before they see their periods. But in these days, girl of 9 years, 10 years can see a period. And this is because of lifestyle changes. The world has changed. A lot of things have changed. You cannot look at the lens. If you look at even the reason why at this moment there's a decline in childbirth, there's a high increase in fibroids, high increase in PCOS, infertility, fertility, everything is just crazy. So why would you have the mindset that women, especially I'm talking about when it comes to the ability to give birth, like why would you compare us to somebody that has existed maybe in the 1980s or 1890s or whatever it is? That's one. Secondly, I don't know why people think that Black women have higher threshold, because the blood we have inside us, is it different? The bones in our body, is it different? Melanin in our body, what is the melanin made for? To protect you from sun, right?
Yeah.
And every other, I don't want to go into the medical process and all of that. So is it the melanin that will stop a woman from feeling pain? There is a systematic stereotype that has been happening for years. And it's unfortunate that we Black women have not spoken for ourselves for a long time. But I'm so happy that these kind of conversations are here. People are speaking up. People are pointing to the system. People are pointing to the healthcare system, whether doctors and all of that, that there is something wrong with the kind of care that we're being given. And if you, in the textbook, when we are reading textbook, there is nowhere where it's written Black women have 5 bones, but white women have 106 bones, something like that. And we believe that, this is what it is, this is what everybody should receive paracetamol. Why do you believe that the pain or the threshold level of both of us are different? It shows you that this is just something that people just sit down and just speak about without really understanding it. And I think it's time that we speak for ourselves as African and Black women. We need to take the space that is rightfully ours that we've not taken for years. And I love it now because when I go on LinkedIn, when I go on social media, I see a lot of Black women speaking about our care. And it's high time that we do that, because if we do not, our children are going to come and pass through the same thing that has been happening systematically. And it's about how do we even start training women to know their rights in the hospitals. If you go to the hospital and thinking about what you're feeling and somebody's underestimating you, what do you do? How do you know your rights? Because sometimes somebody tells you that and you're like, okay, fine, no problem, I'll just take paracetamol. There are cases even here in the UK when somebody goes and is complaining about pain and they ended up giving the person paracetamol, but the person had fibroids. And for 1 year, they couldn't even diagnose that the person had this. What excuse can you give? If for 1 year you've been complaining about pain and they keep telling you it's okay, just take paracetamol while you have fibroid, you couldn't even, and the person is telling you that I feel this pain here, and you couldn't even at least do a scan, say there's something wrong with the system. And we have to advocate for ourselves. And that is why things like Mom and Me, like our app and all of that, when we start building for ourselves, we start advocating and telling women what they need to start speaking about and the rights that they have. So I really do not have so much to tell these people. I think I've said enough, but it's just really sad. I think they just need to, educate themselves, because I don't know what else to call that.
This thank you so much for sharing insights on that. I do have a question about this though, because when we're saying that there's like a growing increase in the rate at which, say, Black women are having PCOS and fibroid, is it necessarily because there's actually a lot of environmental, I mean, it could be, but it's necessarily because there are so many environmental factors, like the way our food is changing and everything, lifestyle changes and everything? Or is it also because there are more people actually actively involved in this test and pushing out this data and doing this research? That's why it looks like we have more. Also, it looks like, it's like there's a lot of people that we weren't covering before, and now it's like, okay, this is a massive number. Like, I don't know if I'm communicating.
Yeah, I understand you. I think it's both ways. I think is one, I agree that there's a lot of factors that has made this, because I'm not saying that fibroid doesn't exist before, but when you look at how fibroid was before, you tend to see that it occurs in higher in older women. And when I say older, elder, like let's say from 40s, from 50s, from 60s, that's when you see people getting fibroids. But in this day and time, even people of 25 years, 23, like nobody's safe. You're at risk to get fibroids. And I would say that lifestyle factors, obviously, lifestyle factors, the things we eat really matter. And another thing is, there's a research that's been done that low levels of vitamin D in African women tend to, has been linked to fibroids. And that is really possible because when you look at the level of vitamin D, because of our skin, because of melanin, we do not absorb vitamin D from the sun. And because we do not, we need to either eat food higher in vitamin D or take supplements, something like that, that would actually help us to balance our vitamin D levels. But over time, a lot of women do not even know that they need to check their vitamin D levels. That this is something that, you know what, when I start reaching a particular age, maybe even from 1920, we Black women should go and check our vitamin D levels. And the reason why I'm even saying that is for me, myself, there was a time that I was feeling really weak. I wasn't feeling so well. I went to the hospital and they checked my vitamin D level. Do you know that your vitamin D levels is really low? Imagine me, because I didn't even think about, like, you can imagine, I'm a medical doctor, but I didn't even think about vitamin D level. Like, I'm like, okay. But, and I agree that there's a link to vitamin D with that. But aside from that, lifestyle factors, that the food, the chemicals we put on our body, the creams, the relaxers, and I'm not saying this based on me saying it, but there's a lot of research that's been done, that's been linked to how some of these chemicals that we put on our body can cause, or at least not cause, but, trigger some of these things that I'm talking about. Vitamin K levels has also been looked at. But I think another thing is that there's so much under research when it comes to even fibroids in African women. If you go to look at the papers, you will find one or two papers here and there talking about vitamin D, talking about this, talking about that. Fine. But based on the statistic that 80% of women, African or Black women, will end up having fibroids by the age of 50, and the amount of paper or research that we've done is minimal or nothing. We need more funding in that area. We need more people to start doing research when it comes to why is there fibroids in Africa. Because aside from all of these risk factors that we are talking about or things that could trigger, why is this happening? And what's the solution? Because right now, when you go, you have more invasive treatment. It's funny how in 2025, still when you have fibroid, first treatment they give you is you need to do an invasive surgery. That we need to take it out. We need to open you up and take it out. Found the solution by now. And I think that is why I'm really passionate about this thing, because African women's health is really under research. We need to start speaking of us. And that's why we need more people, more doctors, more people in the research space that are doing research for us. Another thing, I totally agree with what you've said, that is because now everybody's speaking about it. Now it's social media time,
Yeah.
So if you have fibroid, somebody will write about it. Oh, fibroid is this, fibroid and that. Now we have fibroid month, and that month people come out to speak about their experience. So we tend to see it more. I don't think it means that it's not been happening for a while now, But yeah, I think it's both ways. So we just need to understand what are the lifestyle choices that we can make not to trigger this, and advocate for better policies, advocate for more funding, more research in that area. And then in our own little way, just creating, because when you talk about something, everything is everywhere. It scares people to want to do something about it, because you start seeing things like foundations, or you start seeing people building femtech app for fibroids and all of that. And I think it's really amazing that African women are building things like that for us.
Yeah, this is really exciting times. Like, I'm even seeing there's a lot of research for women in general, like even for diagnosis of endometriosis, and they're trying to like find ways to make it non-invasive. Like,
Yeah.
the more I see a lot of innovation in this area, the excited I get that there may be hope for humanity. I don't know what this is, but this is fine. So FemTech gives me hope that maybe there are people who are right direction. So we'll be fine. So another question I have for you is, what is your vision for the future of public health and femtech for African women?
My goal, my passion, what drives me and what I really want to see is a point where we've built a system of care that's made for us. I am one of the people that really advocate for the fact that the system of care in Nigeria and Africa needs to change. I believe that we cannot keep functioning when we keep adopting solutions for us. And I'm not saying medical treatment or whatever is bad, but we need to start looking at how do we make this fit into what works for us. How do we start? Why do we take away something that's been working for us and replace it? I think the issue with us Africans is that we always tend to replace. We don't have continuity. So we lose focus of what was working or is working because somebody tells you know what, this is the big deal now, this main deal. And we throw away what we know. And it's just like even talking about traditional birth attendants who for years have been doing this thing of, helping women to give birth, and they'll use traditional herbs and leaves, and they know what to rub for during labor to make it easier. Is that perfect? Obviously not.
Yeah.
But is there some knowledge in that would have adopted? Of course, yes. So what I see and what I'm passionate about and the little part of work I want to do is for us to reach a point where we actually criticize the system of care in Africa. And I'm talking about policies. I'm talking about advocating for better ways that care can be given to women. Because let's not even go far. When you go to hospitals, even pregnant women have spoken about it, how nurses treat them, how they're being spoken to. There is no care that actually really speaks for the people. There's an oppressing energy when you go to the hospital and thinking about your pain, even in Nigeria. Nurses are telling you, like, you imagine a woman going to give birth and somebody's telling her, was I there? Was I there when you were having sex? Was I there when this? Do you understand? Like, how can you speak to use that kind of language to a woman that has come to you for care? So there's a whole lot of things we can do. I believe in training healthcare workers. I believe that there's not enough that's been done to train nurses. And I'm not talking about training in the sense of the work that they do, but we need to train people on how to speak to patients or speak to people when they come to the hospitals. So I think my own what I advocate for, what I really want to see in the future of Africa, especially in femtech and all of that, is that we are building with ourselves in mind. That we've reached a point where we understand what care means for us as African women. And for public health interventions, I believe that our public health intervention should speak our realities. That when you're building something, whether it's an NGO or whatever it is that you're building for African women, that you understand the community you're coming to create things for. And enough of borrowing systems that's not for us or the kind of care that's not for us. How about we start innovating and creating systems that works for us? How can we make this system better? What can we do? What can we put in place? And if you keep building hospitals and you keep building clinics, but it's not working, or you keep building, what's the word? You keep building hospitals, just like I've said. Thank you, that's the word. Maternity centers for women, but we still have high rates of mortality rate from 1985 down to 2025. We're only able to reduce maternal mortality by 5%. Over 34 years. Something is definitely wrong. It's either the system that we're building is not made for us, and that's why we need to start looking at the lens in a different view, or the fact that we are not doing enough. But I believe that the system of care that we are creating is not working, because if you are building hospitals, even in clinics, in places, it means that people do not trust it. How do we make this thing trust? How do we understand the behavioral patterns of people that you're building this care for? You cannot have a system of care the same in Nigeria and expect it here in the UK, for example, and you take it to Nigeria and expect people to respond to it in the same way. It is not possible, because these are different people who understand things differently and who believe in a different system, like what means so much to them. So we need to either bring back communities or how to include community setting into our healthcare system, or just start thinking out of the box. We need to start thinking of things that is made for us. We need to start thinking and I love the fact that now we're being innovative, because aside from those days where we wait for people to create something for us, we are creating something for us. And it's good for us, the young people, to start getting into these spaces, to advocate for better things, because by doing that, we can start thinking of even system of care, even hospitals. How do we make hospitals really adapt to the kind of people that we are? And if this hospital is not working, or even if you're looking at primary health care, the system of primary health care, is it actually working for us? If it's not working, how do we make primary health care better and accessible and really speak the language of Nigerians? Let's say, for example. So that is my own passion. And for femtech, I want to see when we are not, we cannot, time when we cannot count the number of innovations that's been done from Africa. A time where everybody or most people in Nigeria and Africa have waken up to the potential in Africa. A time where we are no longer borrowing, whether is not just products per se, but borrowing even when it comes to our language of care from another place. And I look forward to when young people, old people, and I believe in this generation, I believe in the things that we're doing, that we stand up for ourselves and really root for Africa, for femtech, for what we are building, and believe in the potential. Because I think one of the things is that you cannot build for a place where you've lost hope for. You cannot see the potential in a place when you do not believe in the thing. And we cannot keep running from something that we have to provide solution for. Because if we keep on running, and I'm not even talking about running like physically or something, but we need to fight for what is ours. Imagine if the place you've run to, they actually also give up and say, actually, we don't mind, whatever, let it be. And another thing is we need to change our mindset as Africans. We really need to change our mindset, because I believe there's a mindset problem, even when it comes to innovation. And it's sad that sometimes, even when you're building something, the people that you're building it for, they don't believe in what you're building. They don't see the potential. Okay, it's just this person. We need to change our mindset. We need to believe in Africa, to build something for Africa, and for us to actually move Africa, or public health in Africa, femtech in Africa to another level. That's all I have to say. I think, yeah.
Thank you so much. That was super insightful. And I love that you're emphasizing also that we shouldn't dispose of our own traditional beliefs, that we should see how we can standardize them. Because I was having a conversation with a pharmacist for another episode, and she was saying that she also believes in traditional medicine. How we shouldn't dispose of these things. We should adapt them and standardize them so it doesn't turn into what it's not supposed to be. But it's not like these practices were bad per se. They just have to be adapted and standardized with modern technology too. Because at the end of the day, a lot of the practices that we have were just modernized versions of things. Like even the tool that's even used for, like, I saw a random reel on Instagram, I think, and then they were showing tools that were used for for looking into the vagina. And it's crazy how not a lot has changed since then, because it's very weird to look at.
I saw, what? I was reading on that. I don't know. I think 2 months ago, 3 months ago, I was reading on that. And I was reading on how innovation since, I think, 90s or 18 something has not changed. We still use the speculum. That has been innovated in 18 something. This is 2025. But even when you look at innovations for women, is behind. It's like we're stuck in 18 something. It's crazy.
It's crazy. And I love that now, like, on the bright side, there are women, I think it's a woman in Sweden or so, she's inventing a device that's less painful and easier to adjust within the, like, for expecting the vagina and everything. And I'm like, this is the kind of exciting things I love to see, that like actively like working towards building the things that we need, because a lot of things need to change.
A lot needs to change. We enough of us. And let's take away African women now. Because one of the webinars that I hosted recently I said something there. I was like, if you look at this generally for women, irrespective of race, is underfunded, under-researched. Little or no innovation has been done. That you are using speculum of 18 something in 2025. We still have most of our treatment are invasive, and nobody seems to care about that. I said, now think about it. Now, if generally there's this problem, now think about what African women. Don't think about the research. So the research is that less than 1%. I want to think about less than 1%. And when I say less than 1%, I'm thinking about 0.5 of funding that's being pushed to research is actually used for women's research. Globally, less than 1%. That's 0.5%.
It's good that we're having these conversations, because there's a lot. When you put that into perspective right now, like, how underfunded women's health is in general, much less for the African population. It's like,
Sure. It's sad. I think you would not know. And I think during that webinar, somebody said she never understood how bad it was onto this. And I said, this is what people don't want. They don't want us to talk about it. They don't want us to, because once you start talking about it, it will hit you that actually, what are we doing? Because if you don't know, you won't advocate for better.
Yeah, exactly. Like there's so many things. I also like that. I also appreciate that you mentioned like doing this test for vitamin D, because even personally, there are so many things I didn't realize I was supposed to be checking for. While building out Asele, like I started to understand that there are tests that I should be going for.
Yeah.
Like the pap smears, I should be doing other tests. I should be doing that other test. When I hit 21, I should be doing this.
Yeah.
The average Nigerian hasn't even had access to malaria medicine, some of them, much less deciding to do preventive care. So there's so many crazy things.
So much. Things like iron deficiency or even is crazy. That is so common. Or that is something that every
it also affects me as well, which is what I'm building, because I was like, I can't be the only one who's
you
feeling
see, it cannot be only no
diet.
It's not only you. And the problem is that you know that is something you should be looking at. But a lot of women do not even know that iron deficiency is something like they should check their iron levels. Because if you, oh God, you see people who have, maybe they have fatigue, weakness. You know, I've had women who complain to me that actually I feel so weak. I don't know why, you know, when I walk this level, I feel. And the first thing I ask the person, have you checked your iron level? The person's like, what? No, I've never. And it just hits me that sometimes you don't want to post something on social media because you think people already know, but people do not.
Yeah.
You need to act like people do not, and you need to put it out there.
Yeah.
For every African woman, your vitamin D levels, your iron levels, all of those things are things that you should always check. And just like you've said, when I've not even gotten access to the basic care that I have, how do I know the kind of care for a woman that should be doing preventive care that I should start doing? How many hospitals or how many people how many times have you gone to hospital and they've said, actually, let's say in Nigeria, they've said, you need to come for your smear test. How many people have said that into young women at the age of 20 or 21? How many times have you heard that?
Not a lot.
Actually, you know, we need to come and do God. We need to do, because let me tell you something. Almost 90% of African women have human papillomavirus. What's that human papillomavirus? That is what can end up, you know, when you have it, can lead to cervical cancer and all of that. It's not, it's just there. So it has to mutate or change form or something before it can now lead to cancer. But most people have it. And if you do have that, you're supposed to go for test every single year, so that they'll be sure that it has not changed form and it's not going to lead to something. But how many African women or Black women or young women know if they have human papillomavirus or not?
Not
because most people got it through birth, through their mothers. That's why I said it's really common. Until one day, cervical cancer is there and it would have been prevented if only every year you keep on going. Because if you go every year and you catch it soon, that actually is changing form and something's going to happen, they treat it. In fact, let's not even go far. There's supposed to be a vaccine for every woman, at least, to get the anti-vaccine for human papillomavirus. Please, I want to ask you, how many African women have done that?
Not a lot, but I think it's starting to change, because I think we have platforms like, say, Health Tracker that are making these things accessible, which is really exciting to see.
I'm so happy that people are speaking about it now. And that's what you can see, that there's a big gap. Because if it's now that we are starting, it shows that we have so much work to do. And it's not about even staying online and typing and writing. It's that we need to move and go into some of these places and start speaking up for people. It's really...
It's a lot of...
That's what I want to see. And I'm just so happy to see, you know, people like you, you know, everybody going into the women's femtech space and just speaking up, talking about basic things, fibroids, talking about PCOS, talking about things that everybody was afraid to talk about.
Yes, it's very exciting now. Like, I can easily talk about my period, which was something that I thought was shameful when I was... And then also growing up and understanding that a painful period is not normal, because for years it was like, oh, it's just part of being a woman. And now it's like, whoa, that's not normal.
It's not. Yeah. True.
So really, really exciting times. And we are headed towards the end of the podcast. So I have 2 more questions for you and then we wrap up. So I introduced this question to the podcast for fun. So, what would you tell 15-year-old you?
That's really interesting. What would I tell my 15-year-old me? In what sense? Do you mean maybe something she should do or not do?
Just in general, like how your life is going, or something you wish 15-year-old you should have known.
I think what I would say is that you stop worrying.
Mm.
Stop worrying because you're already living in some of the dreams that you've had. And I think one of the things I would say again is that because growing up at age 15 and all of that, I was really, really quiet, timid, and shy. I believed in the potential I had inside of me.
Mm.
And even from age 15, I knew that I was made for more or created to make an impact.
Mhm.
But it didn't look like it. Obviously, I was just 15.
Yeah.
I was, I didn't think, I think I would just tell my 15-year-old self that, you know what, just go to bed and sleep. Because it turned out to be fine. You're no longer that quiet and shy person. I always knew, even at age 15, that I was going to attend podcasts like this. I always knew that um I was going to do something. I didn't know that it was femtech or mama me or maternal health. And I think what I'll just tell my 15-year-old self is just relax because you're too serious. I've always been too serious, believe me. I always I don't think when let's say from age 15 I've ever rested. I was always up to something, writing book, creating this, building that. And what I would have just said is just, enjoy that you're 15-year-old because it gets tough. It gets tougher. Just relax, read. Well, relax. Just have fun because everything would be end up being fine. I think that's what I would tell my 15-year-old. So
That's so sweet. And when you were talking about being timid and shy and everything, it reminded me of, I've been watching too much YouTube these days, but oh well, I think it's good stuff. But basically,
yeah.
somebody was saying that something from I think she's Asian, and I think like some Asian countries they share some kind of cultural nuances with Africans, I think, from
Yeah.
what I've observed so far. She was saying that like she grew up in a culture where like you have to respect your elders and you are not allowed to like you have this like mindset that you have to be quiet where people are speaking, that kind of thing, and especially when you're a woman. And then she said that what her advice is for people, especially people in their early 20s, is that when you grow up you have to dispose of that mindset, how to speak up for yourself and learn how to advocate and learn how to speak to people, because people, at the end of the day, the people you're putting on a pedestal are just people themselves. So it's not like you're going to be in disrespectful or anything, but you should just learn how
Yeah.
to not be so timid and put people up on a pedestal that, oh, this person is some kind of glorious,
True.
I should worship or something. So you said that reminded me a lot. Yeah, that's African culture is very like heavy on respect, which is
True.
isn't necessarily a bad thing, but
I
coming out
totally
as
agree.
coming out as a 20-something-year-old professional now, it's like, okay, I need to learn how to like speak to people and stop
True. Because
doing
you
that.
never had the chance to. And
Yeah.
it's sad that growing up, you want to air your opinion, but it's like, what are you saying? Like, when elders are saying or when somebody's saying something, you shouldn't say anything. And I think it's a system that's really wrong because
Mhm.
most of us grew up afraid of our own voice,
Yes.
afraid of our own thoughts. You always doubted, should I say this? And that's really bad because you find that it's a struggle because you have to unlearn. For me, I had to unlearn a lot of things. I
Mhm.
had to, and it takes a lot of strength, resilience for you to unlearn not wanting to hear your voice. I don't know how to explain it. To believe in your voice when all you heard, let's say growing up, was no, your opinion is not welcome here.
Yeah.
Something like that. Not like they mean it in a bad way, but to them, that was how to keep you on track and not to say the things they're not supposed to say or act a certain way.
Mhm.
And yeah, I think what that lady said is really, really right. And we need to do better because I don't wish it for anybody.
Yeah. All right. And thank you so much for sharing so many of your insights. It's really great. I know you share a lot of like very important things on LinkedIn. So I wanted to ask you what's the best place to reach out to you or to learn more about your work beyond LinkedIn? Because I already know you're on LinkedIn. Like, do you have any other?
Yeah, I'm on Instagram. Though my Instagram is a little bit more fun, but I try I try because on Instagram I talk about Mom and Me Foundation. I talk about women's health as well. Things like fibroid, well, you need to do and all of that. I talk about my journey as a founder, starting Mom and Me. I share sometimes the struggles or what I've learned, what people can do. Yeah, so I think Instagram would be another place that people can connect with me.
Okay, and what if the person also wants to learn more about to support, say, Mom and Me, or they want to learn more about your app?
So on LinkedIn, we have Mom and Me Foundation, our official page, and we have a website as well, www.momandmefoundation.org, and where you see our work and all of that, where we are based at. And for MyLurah as well, we are on LinkedIn as MyLurah. And our website is mylurah.com. We're on Instagram and TikTok as well. Yeah. For Mom and Me as well to see more, because I think we post more on Instagram. So you'll see our work, you see our, content, a lot of things that we do on Instagram. So LinkedIn is a little bit different, but we are also consistent on LinkedIn. So I think the website and Instagram and LinkedIn, those are the two places I would say that you really see what we do.
All right, incredible. Thank you so much. It's been a pleasure having you on the podcast. I have another question that just popped in my head. What does Lurah mean? Or MyLurah, what does it mean?
So MyLurah, mine, obviously for and Lurah means care in Hausa. Yeah. Okay. So that means my care. Yeah.
Really cool.
I want to Asele.
Okay, Asele. It means chosen. So it's basically my mom's name. So I named the company.
That's so sweet.
Yeah. And which is why I'm really excited to have this conversation with you, because I think from what I understand, she passed away when I was a baby. So from what I understand or what I've gathered so far is she passed away from postnatal complications.
Oh no.
So which is why I'm happy that we're having this conversation.
Yeah.
If she had probably the right access to care or thing, maybe she would still be here. Yeah, it's wonderful that we're having these conversations now.
Well, that's so, you're really, really strong. It takes strength for you to build on something like, especially when it's something as sensitive as losing your mom and creating a company to kind of honor her and going into that space. It takes so much strength, because for some people, they'll shut down, having to do anything in that space because it kind of reminds them of that. So that's really good. It's really good.
Thank you so much.
I should be very proud of you.
I hope so. I really hope so. And I love when people say the name, because I think I saw part of the reason why I named after her was because I saw a quote. I think it was during the Black Lives Matter movement, where I think it was something along the lines of, when you say a person dies twice, once when they actually die, and the second time that people stop mentioning their name. So I really love it that as I'm building this out, I'm pushing her name as well, and it just gives me the sense of she's still here. So it's really cool.
Yeah, that's really good. Good.
Awesome. All right. So this is where we wrap up the podcast.
Okay.
Hi again. Thank you so much for listening to this episode of Blush and Bloom. I'm so glad you joined me for this conversation. If you found it helpful, please share this episode with a friend or someone who might need it. Let's keep talking about women's health and working towards better outcomes for all of us. You can find more episodes and resources at www.asele.tech and check out our app at www.asele.health. And you can follow us for more updates on Instagram at asele.tech. Until next time, I'll see you in the next episode. Take care and bye-bye.